keep your microphones and video off unless you're presenting or asking a question. And I'll just introduce myself. I'm Kerryn Husk. I'm from the University of Plymouth, and my colleague Jules Ford from NHS England, NHS Improvement, is co-chairing with me this afternoon. We have 5 presenters. We'll be keeping them very strictly to time. We've got 6 minutes per presentation, plus 2 minutes for questions, which gives us a nice buffer for 10 minutes at the end to have a good discussion about any of the main themes that are coming out in the chat. So as the presenters are giving their presentations, please do use the chat function, ask any questions, make any comments. Jules will be keeping a close eye on that, and then hopefully we can come back at the end to any recurring themes. I think that's everything. So without further ado, I think I will pass you straight over to Michelle Howarth from the University of Salford for the first presentation. Over to you, Michelle.
I think Cormac slips. That's it, sharing our slides. Thanks, Cormac. So we're delighted to present the findings from our qualitative evaluation of the first RHS Wellbeing Programme today. This picture here of me, Anna and Cormac was taken at one of our meetings in the grounds, and I have to say it was the best office space ever. It did change later on, as Anna will describe. Hopefully our presentation will give you some insight into the impact that the Wellbeing Programme had on people. And I'm going to hand over to Anna to actually start our story and provide a bit of that context first.
Okay, so I should just start off by saying that I'm not with the RHS anymore, so I'm not speaking on their behalf, but I can speak about what we did under this programme. At the time that we launched this, I was called the Programme Director of RHS Bridgwater, so I was essentially overseeing the whole project. And it was a really significant project. We were developing the 5th National Garden for the Royal Horticultural Society, the first new garden in 20 years, and critically their first and only urban garden. And so a key focus of my role was to really see in the development of the garden, how could we maximise the kind of social, economic and environmental impact of the garden while creating a lovely visitor destination. And that represented quite a change for the RHS. And a key theme within that was really dialing up the health and wellbeing focus and deliverables of this project. I think there had been a lot of research, including by Michelle, by the RHS, evidencing the benefits of exposure to green space, but there seemed to be a real challenge in transitioning that into action on the ground, and this felt like an opportunity to do that. So we formed a partnership with the RHS, the enhanced care team of the local NHS, and Salford University as a research partner. We got some money from the local CCG and we set up this project. And I'd just like you to take a look at that picture. That's myself with lovely Fove, who was an OT from the NHS. And that was the context in which we were delivering this project. Remember that picture for the end of this presentation. Next slide, Cormac. So, I mean, this was a very new approach for the RHS. It was the first kind of hands-on social prescribing project within the RHS, and as such, we were also able to recruit the RHS's first ever therapeutic horticulturalist, which is Azichi, on this slide, and I don't know if she's actually attending the conference. And there's a bunch of quotes there from participants in the project. But I think it's just to say it was so important to find the right kind of person who was up for working in what was a muddy building site with absolutely kind of no provision at the word go, but also with absolutely the right kind of energy and attitude towards the kinds of referrals that we received. Next slide. So the space that we used, because we were full on building site at this point, was actually a kind of disused retired scout hut. Not the most salubrious of surroundings, and at the point when we started there was just a sort of patch of mud out of the back of it. One thing that was lovely about this project was that the participants actually created the very first kind of gardened space and the first flowering plants within RHS Bridgwater, and named it the Spinney, which is this picture that you can see on the slide. And it wasn't our intention at the start of this to maintain that space. As part of the wider garden project, a much more formalised wellbeing garden has been created within the walled garden at Bridgewater. But actually, this space has also been preserved going forwards as a more secluded private space for therapeutic interventions. So I'll pass on to Cormac, who I think is just going to summarise kind of some of the key themes that emerged from this piece of work.
Yeah, well, thanks, Anna. As Anna alluded to, this project was very much underpinned by research. It was very important that we captured the impact and so on. So we set up a referral pathway that was very much defined through the enhanced care team and the local community connectors, part of Wellbeing Matters, Salford's local social prescribing service. So those long-term conditions were a range of physical health conditions, but also social isolation, anxiety, and the need to, engage with other people and improve confidence. Overall, 47 people in total were referred to the programme, of whom we interviewed 11. And we also interviewed RHS staff and wellbeing volunteers as well. And we're focusing in this presentation on the qualitative data, which I will get into now. So 4 key themes emerged for us. First of which was this creation of a safe space, and this spinny space that Anna described was very much that. In that scout hut, people felt safe, they felt relaxed, so much so that they could sing together. And that final quote that you can see there, they felt that maybe people would, if they opened the door, think that they were like a bunch of screeching bats, whereas they thought that they were the Salford Community Choir. But they felt released. There was something about it, the safeness of this space, that the nurturing quality, that they felt that they could be free again. Another key point is that this activity was very much centered on the person and what the person wanted and what the person needed and what the person was able to do. So the hanging baskets that you can see there was an activity that people could do while sitting down. It wasn't something that you had to bend over and do. The activities weren't limited to gardening either. They were arts-based that you saw in the previous slide, as well as crafts and so on. So there was a whole range of activities that connected with the person's background. The wellbeing volunteers made sure to know about the people who were involved, what their background was, whether they had a background in woodwork, joinery, for example, and those were ways in which people were engaged. Another key theme was that people felt that they were part of history, that they were actually part of making history in Salford, that this development of the RHS Bridgewater was very significant, that they felt proud and honoured to be part and parcel of it. And that when it's all done, when it's not a building site anymore, that they looked forward to the opportunity to come back and show people that they were part of this at the beginning. And they looked at a notice board with quotes from people who had been part of the site in the 19th century, in 1872, quotes from people from that time, and they felt connected to those people in a way that they would then be visible to people in the future. And part of that site's history. The final quote, I'm whipping through these very quickly because of time, but is the transformation on health and the fact that people not only reduced in their medication, but it was transformational. That was the way that people talked about it, that it saved them, that it did in the world of good. People said that they had given up before they had joined the RHS, but this gave them that spark that they didn't have before, that they had been just on their TV watching another box set, but this gave them some meaning. That was a very quick run through, but I'll hand you back now to Anna and Michelle for some final conclusions.
Thanks, Cormac. So I think, the theme of this whole project was really transformation. So transformation of the site, transformation for these individuals, and actually also transformation for the RHS as an organisation. The programmes were supposed to be 12 weeks long, but actually nobody wanted to leave. So we had to create a kind of follow-on programme for them, which I think speaks for itself. But I think what I was particularly pleased with is, there was some cautiousness about undertaking this within the RHS, but it's really been embraced going forwards. This picture you're looking at now is where that horrible muddy picture was taken, so that's what the site looks like now. And within that area there is now the Wellbeing Garden, and there's all sorts of ongoing wellbeing activities still delivered by Azici happening there, but also a much wider range of activities across the RHS.
I guess just to say some of the lessons learned from this, obviously we learned how valuable that the green space was and nature-based interventions, but we learned a lot around the referral pathways and the need to widen those to make sure that more people could be referred, to work more closely with the social prescribing link workers. And also we had to do a lot of work with GPs and other practitioners to get them on board, to get them to understand that this was a really opportunistic and novel way to improve well-being. And then the sheer practicalities, obviously most nature-based interventions are support people with long-term conditions, and just generally getting them into this space, which is, you know, kind of, it's in Salford, but it's kind of out in the middle of nowhere almost, was one challenge. And then making sure that they were safe within the environment was another challenge, etc. But this work clearly demonstrates the need for a sustainable model of green social prescribing. And I guess the evidence really suggests that it offers something intangible yet invaluable. And people did actually lose themselves in nature and find themselves in the process. We have published in the journal Health and Place the full findings if you're interested. The link's in the next page, but thank you very much for your time.
Thank you, everybody. Really interesting, and yeah, lots to talk about. I can see some comments in the chat, but in the interest of time, I am going to move us on to the next presentation because we have got such a busy schedule. So if it's okay, we'll move straight on. The next presentation is from Sureya, and it's about a Walsall case study through design-led research. And Sonia, if you're okay to share those slides, that'd be great.
Hi everyone. Sonia, thank you for sharing those. I didn't realise you had the slides. I think I've just sent them to you as well, Cormac, so just ignore that. I think I sent you a watered down version. Okay, so I'd like to talk to you today about Nature's Way, which is a design-led research project. It's a collaboration between the Royal College of Arts and the Department of Landscape and Architecture at the University of Sheffield, Hallam. We've come together with partners from public health, private and third sectors, including Intelligent Health, the City of Bradford Metropolitan District Council, Husk Technology and the Mindkind project. So we are a multidisciplinary team made up of academics, industry partners, VCSE organisations, and my name is Sureya. I have the privileged position of being the CEO of the Mindkind project and also the co-investigator on this research project. Next slide, please. So the Mindkind project was really born out of a desire to help people in deprived communities to really level up. We're a multidisciplinary team, and our desire to reduce health inequality has led us into supporting this research project. Next slide, please. So we do this through activities built by our specialist team of social workers, mental health practitioners and community leads. It includes things like specialist support groups for men and for women, and more recently, our dedicated hub in the heart of Birchall's Leamore. More recently, as a product of the research, we offer a green space within the heart of the community to help people access food growing and green engagement. Next slide, please. So Nature's Way is an 18-month research project which has sought to understand the way in which we can co-create methods to bring people together and closer to nature-based solutions for public health and green recovery in a post-COVID world. Nature-based solutions operate in often complex ecosystems of overlapping jurisdictions, multiple sectors, uncertain funding and competing interests. Post-COVID, the increased level of demand for green engagement means that we have needed to review the complex system in order to support local actors within that system, to support them to navigate it and to produce solutions that work in their specific locality. So our research has therefore led us to taking a closer look at the relationships that exist within Walsall, community-led nature research solutions and how they act within the social prescribing and green prescribing sort of setting. Here you can see that community-led nature-based activities as social innovation are the central point of our work, and what we've done is we've sought to understand the existing relationships between nature-based solutions and the NHS and how it manifests within green prescribing in a Walsall context. The research has looked at health inequalities within Walsall, how Nature for Health can work for future sustainability, and how nature-based solutions work currently within the landscape. Next slide, please. So far, we've engaged over 40 organisations through the research activities. And Nature's Way seeks to use design as an action research method to co-create ways of accessing and sharing otherwise disconnected and not readily available knowledge, resources and practices for innovating nature-based solutions. Our ultimate goal is to empower communities and organisations to innovate and develop their own nature-based activity for public health and for social care following COVID-19. We'll do this by using design methods to create a platform which allows individuals and organisations to share knowledge and resource more easily, supporting them to create their own nature-based solutions. Next slide, please. So Walsall is one of 7 metropolitan boroughs located in the West Midlands and one of the 4 Black Country authorities. The borough contains a mixture of urban and rural landscapes, and with a population of just over 280,000, you'll see that Walsall falls into the top 20% of most deprived local authorities in England. We have a lower life expectancy than the average for both men and women, and people within Walsall have on average a higher disconnect with physical activity. And that forms part of both adult and children's statistics. Next slide, please. We can see from this map that Walsall actually does have a lot of green belt area around it. We can see that people have access to parks, green spaces that they could access for health and well-being. The local authority invested over £250,000 in 2020 to support community green spaces, and despite this, the health statistics that we've just touched on suggest a clear disconnect between the opportunity for people to engage with nature-based solutions and what we can actually see is happening in reality. Next slide, please. So in order to deliver the project, we've consulted with organisations at a national level and at a local level. We've conducted formal and informal interviews with a huge range of individuals, including national trusts, charities, funders, conservation groups, and individuals in terms of residents, to ensure that we've sort of gleaned a lot of qualitative data. Next slide, please. At Walsall level, we've engaged with a number of nature-based solution providers, and that includes Borneo Street allotments, the Butts Community Garden and so on, as you can see from this slide. Next slide, please. So as you can see, the research team have actually been really successful in spending time and gaining a range of qualitative data, using the pilot as a mechanism to understand the landscape within Walsall at different levels, from grassroots to newly established gardens through to speaking to funders. And within that work, you can see from this slide, we've created 2 user journey maps that have really informed our work. Next slide, please. I'm just going to march through these now. So you can see from this slide, one of our researchers out in the field. We've done a lot of talking and listening to really understand how people at the heart of these activities are involved in green prescribing and how they've been impacted as well. Next slide, please. So as people that work within the sphere of social prescribing, we all have an understanding of the definition of social prescribing. But within the context of our work, the definition for green social prescribing being linking people to nature-based interventions and activities for well-being has really been the focus for our work. Next slide, please.
Sorry, I'm just going to jump in. I wonder if you could bring us to a close in a minute, if that's all right.
Yeah, that's absolutely fine. So I'll just power through the last few. So our focus within Walsall has been looking at the social prescribing model that currently stands. So currently Walsall is divided into 3 strands of social prescribing. You can see here we have the primary care network. We also have Walsall Housing Group Social Prescribing Network, and then the Walsall Council's social prescribing network, which is delivered through 4 individual hubs. Next slide, please. Walsall is unique in the sense of, sorry, if you could go back 1 slide. Walsall has uniquely come together and created the Walsall Together Partnership, which provides further opportunities for the collaboration of GP practices, housing groups, the Walsall Council, adult social care, public sectors to come together to find more opportunities to work together for social prescribing and green prescribing. If we can move on to the next slide, please. So nature as an option, we've found within our key findings that actually nature-based solutions are not always seen as a recognised pathway for social prescribing. There's resistance from referrers to use it as a pathway due to less evidence and recognition of the demand for nature-based solutions. Next slide, please. So in conclusion then, and I'll quickly bring this together, we've found that although nature-based solutions really are now coming to the fore and there is an increased demand, because they are less recognised within the system of social prescribing, there is not a recognition of the delivery costs. So people see nature as a free space and a free activity. However, hidden costs such as maintenance, site security that are associated with delivering nature-based solutions within VCSE organisations, including volunteers and admin work, is simply not recognised, leading to a poorer experience for those organisations that are involved. Next slide, please. That then means that the complexity of the system is harder for local actors to navigate within the system. So often they are limited by funding, limited by resources, and because of the complexity of the system, often find it difficult to find their role within the system of green social prescribing. Next slide, please. Major players and funders such as National Lottery still support nature-based solutions really well. However, those funds tend to go for infrastructure rather than for people and volunteers and things like that, which build the resilience for nature-based solutions. And so we've found through our research that a lot of local VCSE organisations mentioned funding as being one of their key challenges. Next slide, please. We found that where local authorities are really supportive and influence nature-based solutions, the VCSEs have a much better and more positive experience and can therefore provide green social prescribing nature-based solutions at a more sustainable level. Next slide, please. And I'll finally conclude then. So we have found in terms of nature-based solutions, there needs to be better governance beyond individual organisations, better funding pathways, better infrastructure, including the green infrastructure, which green social prescribing relies on. We need to take a more holistic approach to understand the complexity of local systems, in contrast to a narrow sectorial focus. There's an emergent need to understand how the soiled actions impact the whole system, including their effects on individual experience. The project has engaged with a large number of stakeholders, both locally and nationally, and what we've found is we've recognised the importance of a genuinely bottom-up, place-based, strength-based approach in order for the actors within the system to work in a more collaborative way and share that knowledge, which we will be producing as a platform at the end of the research project. So now we're really strapped for time, so I'm going to conclude there. And if anyone does want further information on the project, please do not hesitate to contact us.
Thank you, Sureya, and sorry for jumping in. We've got such a packed programme this afternoon. I'm going to move straight on then, in the interest of time, to Claire Wicks from the University of Essex, please.
Hi, I'm actually presenting with Carly Wood as well, and she's going to start us off and share our slides. So.
Yeah, thank you, Claire. Sorry, hopefully they're just uploading. They always seem to take a bit of time. Hopefully you'll be able to see them in a moment. Can you see those okay? Hopefully.
Yes.
Brilliant. So thank you very much for inviting us along today. So we're going to talk to you a bit about our project, which is focused on the barriers and facilitators to referral and uptake of community gardening as a green social prescribing activity. So 1 in 6 individuals experience a common mental health problem such as anxiety or depression at any time, and common treatment approaches include antidepressants and psychological therapies, but their effectiveness may be limited. For example, evidence suggests that for depression, antidepressants might only be effective compared to a placebo for those with severe depression. Community gardening is one type of green social prescription which has been identified to have a range of health outcomes, such as reductions in depression, anxiety and loneliness, and increased feelings of community cohesion and support. However, much of this evidence is not necessarily in individuals with mental ill health or a particular health need. In order to support more widespread availability of community gardening as a social prescription, we need to also understand the mechanisms by which community gardens can impact mental health and what are the key barriers and facilitators to not just referral and uptake, but also continued engagement with the projects. So our aims were therefore to understand from a range of perspectives how community gardening might impact mental health of attendees, and to identify the barriers and facilitators to referral by link workers and uptake and attendance by individuals. So in undertaking this work, we've partnered with TrustLinks, who are an independent health and wellbeing charity located in Essex. And as one of their services, they provide Growing Together, which is a series of community gardens across Essex. They currently actually now have 5 gardens, having opened a new one recently. So Growing Together provides holistic support to adults with various mental health diagnoses, from depression, anxiety, and through to individuals with learning support needs. So typical referral routes would be via GPs, social prescribing link workers. Individuals are also prescribed through job centres, and some individuals also refer themselves to the programme. The gardens themselves are supported by mental health support workers, gardening staff, and members of the public who volunteer. And individuals typically attend the gardens 1 or 2 days per week and engage in a range of activities from planting, garden maintenance, weeding, etc. So there's a whole host of activities, and these are generally self-selected by the individual, so they can go and engage in whatever activities they wish to. So for this study, we undertook purposive sampling so that we could include a range of stakeholders representing key personnel involved in Growing Together, from referral through to delivery, and the members of all the gardens. So we undertook semi-structured interviews with a range of stakeholders, which included Growing Together staff, social prescribing link workers, and mental health support teams. And we also undertook focus groups with 20 garden members from across all of the different gardens, with a range of diagnoses and duration of attendance at the garden. So our interviews asked participants questions about what they felt the barriers and facilitators were to referral and uptake of the service, and how it impacted mental health from their points of view. Whereas our focus groups with the garden members were focused about asking how the garden had affected their mental health, and more from their personal journey and experience. So in order to analyse this data, we combined all of our interview and focus group data, and we analysed our transcripts thematically, and we were very much guided by the research aims. So 2 interview transcripts were coded independently, and then we developed a coding framework by which to code the remaining transcripts. But these themes and codes emerged as the analysis progressed. The final themes identified, the overarching areas are the impact on mental health and the barriers and facilitators, but we identified a number of sub-themes around those, which Claire is going to talk to you about now.
Thanks, Carly. So our first main theme was impact on mental health, and this describes the mechanisms through which engaging with Growing Together enhanced members' mental health. The first sub-theme was nature and the outdoors, and this describes the health-enhancing benefits members report experiencing from being exposed to the natural environment. So, for example, gardening tasks offered a distraction from their mental health and mental health. Also through feeling connected to nature, for example, observing plants and wildlife in the gardens, members were able to positively reframe their perspective and described feeling happier. The second sub-theme is social support and relationships. This was where Growing Together members and staff described how members' shared experience of mental ill health helped to create a sense of belonging and a positive non-judgmental space for recovery. Members and staff described the gardens providing opportunities for members to be their authentic selves and experience friendships and acceptance. And this gives members the confidence to build social relationships in and outside the gardens. The relationships members establish with the wider community, for example, through open days and selling produce, also helps to build social cohesion. The second main theme, sorry, next slide please, Charlie. Okay, the second main theme was facilitators, which describe factors that facilitate referral, initial engagement and continued attendance at Growing Together. Our first sub-theme was the holistic approach of Growing Together. Stakeholders interviewed described a range of potential benefits from attending Growing Together, and these included physical activity, social support and being outside in the natural environment, with exposure to nature, fresh air and vitamin D all perceived as beneficial for health. Members are supported with various aspects of their lives, including opportunities for developing life skills, vocational training and support accessing additional health and social support services, and this ensured the health and well-being of the whole person. The second sub-theme is flexibility and inclusivity. Growing Together is very much person-centred and members have choice and flexibility in how they engage with the service. This includes which activities they engage with, and there's no fixed duration of attendance. Some members choose to take on specific tasks, such as cutting the grass, while for others, the way in which they engage depends on how they feel on any given day. Members know they'll be accepted regardless of how they're able to engage with the project. And then the next slide. The third main theme is barriers, and this describes factors that create barriers to referral, initial engagement or continued attendance at the gardens. So the first sub-theme is awareness. Stakeholders commented on the need to raise awareness of Growing Together. For example, social prescribing link workers in particular felt that knowing more about the full range of services available at Growing Together would help them sell or match individuals to Growing Together. And this was especially important where the individuals didn't have a prior interest in gardening. The second sub-theme was accessibility. And this was about factors such as the physical location of the gardens, which can prohibit engagement, particularly for individuals without their own transport. Link workers shared that many individuals could not afford public transport and felt unable to use it due to their mental health. Health status is also a barrier. Physical health conditions could limit the engagement with gardening activities, and also members' declines in mental health or changes in medication could cause members to disengage for periods of time. So to conclude, Growing Together has a positive impact on the mental health of attendees through engagement with nature and the outdoors and the development of social support and relationships. To support referrals, uptake and attendance at community gardens, a holistic, flexible and inclusive approach is recommended. And finally, raising awareness of the full range of service provision with referrers and supporting individuals in accessing garden sites is essential to increase referral and uptake to community gardening services. And that was very brief.
Thank you very much, both. And sorry, Carly, for leaving your name off at the beginning there. That wasn't intentional. Completely.
Thank you.
Thank you both. Fantastic. So we're now moving on to hear from John Grace, who's from the Greater Manchester Health and Social Care Partnership and Salford CBS. If you're able to share your slides, John.
Yeah, should be up now. Cool. So thanks, Karen, and hi, everyone. Yeah, John Grace, Programme Manager, Greater Manchester Health and Social Care Partnership. So to set the scene for the issues facing Greater Manchester, I thought I'd start with a very quick overview of some of the health inequalities we're facing. You can see here that for life expectancy, it's far short of the national average for both men and women in all except 2 of the 10 local authorities in Greater Manchester. Even within Greater Manchester, there's huge variation in life expectancy. Someone living in Timperley can expect to live 12.6 years more than someone living in Rochdale, a distance of just 16 miles. We can see further disparities in the proportion of jobs that are low paid in Greater Manchester. Again, 8 out of the 10 localities are worse off than the national average, and there are huge pay inequalities across the region. It's also estimated that between 12 and 15% of households in Greater Manchester can't afford to heat and power their homes to the level necessary for good health and well-being. Whilst these things don't guarantee poor mental health, we know that they do contribute to health inequalities and can be driving forces for long-term mental health issues. At the same time, we know that mental ill health has increased significantly across society. We know that people want better access to green spaces, more community facilities, more supportive neighbourhoods, and more social groups to help with their well-being. But sadly, individuals from lower socioeconomic backgrounds are less likely to visit green spaces and are less likely to have good access to green space in the first place. So whilst we have huge health inequalities and a lack of access to green space in communities that need it the most, we are also well aware of all of the benefits that nature can have on mood and mental well-being. So I think it's safe to say that we understand the scale of the problem facing society's mental health and how this has been exacerbated as a result of the pandemic. At the same time, we're also in an environmental and biodiversity crisis. A climate emergency was declared in Greater Manchester in 2019. Greater Manchester has also implemented a 5-year environment plan, and one of the key components of that plan is to use the natural environment as a method for preventing and treating poor mental and physical health. Increasing access to green space and using nature-based interventions from a population health perspective is also a key work stream sitting under Greater Manchester's Local Environment Partnership. Tackling health inequalities and achieving our environmental goals are entirely complementary activities. And the out of 4 images here are from the University of Exeter's Excellent Nature on Prescription Handbook, which I think someone has already posted in the chat, but I would go there because there's loads of great resources in that. So Greater Manchester is one of 7 national test and learn pilots working with NHS England to test how to scale up the delivery of green social prescribing to tackle and prevent mental ill health. This is a 2-year pilot project that aims to use our connection with nature to improve mental health, with a particular focus on reaching those who suffer the most from health inequalities. We're looking to engage people from all sectors of the community, including those who may not use traditional services, and to work in an inclusive manner to address those health inequalities. Along with the national pilot, we want to see green social prescribing become a standard non-clinical intervention within the mental health pathway as an additional treatment option, providing greater choice of intervention for people. We're working to ensure that we have the right skills and capacity within the VCSE sector to drive delivery. We're testing different interventions to ensure the right offer exists for every individual, with a strong focus on mental health. We also have a county-wide initiative to create a movement and increase society's understanding of what nature can do for our mental health, as well as what we can do for nature. And then underpinning all of this, we're looking to implement a sustainable model of delivery embedded within mental health to ensure longevity and provide the sector with a genuine opportunity for impact in the long run. And I'd be remiss if I didn't give credit to the lead delivery partners that are part of this programme in Greater Manchester. There are lots of organisations and partners involved, but we've got 5 kind of key organisations across the different localities in Greater Manchester that are leading as the kind of anchor organisations. Using organisations rooted in the communities we are trying to reach is essential if we're to create the desired impact. The VCSE sector has been doing this for years. They're at the heart of communities. They understand their community and are best placed to design and deliver these types of interventions. So finally, just to end a little bit on where we are right now, we're just coming up to about halfway through the 2-year programme, and we've seen huge cross-sector support and interest to be involved in delivery. We know that what we are doing is aligned with many shared objectives from across the health, the environment and the BCSC sector. And we've seen good growth in the number of nature-based destinations that didn't exist before the programme. All of this hasn't come without its challenges, and we know we need to do more to secure long-term funding commitments. We need to get more people using nature to help with their mental health, with more support and buy-in from the mental health pathways. The quality of data is also lacking. Whilst we know how many people are taking part in the programme and their place in the community, the system lacks the data needed to really understand impact and channel resources to where they need to be. We also know that as numbers continue to grow, we need to support the workforce with the right training and skills to ensure safety and increase the quality of interventions provided. So thanks for listening. That's my email address there. I think these slides are going to be sent out afterwards, so do feel free to get in touch if you'd like to know more about the programme in Greater Manchester.
Thank you very much, John. And selfishly, very pleased to see the University of Exeter Nature on Prescription handbook given a shout there. The link is in the chat, and fantastic if people can go and have a look at that. I can also see some questions in the chat about sharing slides and links, which is all great, and I hope speakers will do so. But I should also point out that this session is recorded, so everybody who's here will be able to access this session and all the others for the next 30 days through the conference platform, I think. I'll now move on. Our final speaker is Nina, who's going to give us a talk about the Conservation Volunteers Green Gym programme. Nina, if you're there and able to share your slides, that'd be great.
Hi everyone, I think my slides are just uploading. Thanks for the introduction. So my name's Nina Smyth and I'm from the University of Westminster, and myself and colleagues, so Lisa Thorne from Westminster University and Carly Wood from Essex University, who you just heard present, worked with the conservation volunteers, so specifically Craig Lister and Dominic Hall, to evaluate their Green Gym programme. So we looked at the wellbeing benefits of the Green Gym programme. Okay, so Green Gym is users can either sign up themselves to volunteer, or they can be referred via social prescribing routes. And basically, it's an opportunity for participants to engage in nature-based activities such as planting trees, growing food, digging wildlife ponds, etc., whilst in nature and whilst in groups. So it's an opportunity for physical activity, exposure to nature and social interaction. So all of which are associated with well-being and health-related benefits. So users can engage in these the Green Gym on a weekly basis, and normally they last about 3 hours. So we analysed the data that was collected by TCB, and they asked their Green Gym users to complete demographic variables, their health status, and to complete a standardised measure of well-being prior to engaging in Green Gym, and then at various time points after their engagement in Green Gym. So at baseline, so prior to engaging in Green Gym, we had over 800 participants complete a questionnaire for TCB, and we had a good number of equal number of males and females, and we had about 41% of the Green Gym users reported a health condition, and a third of the sample lived in they were living in a deprived area of the UK. So at follow-up, so the participants were asked to complete a follow-up measure after engaging in Green Gym. So the first follow-up measure was on average about 4.5 months later. Now participants completed their sort of follow-up measure at different time points. So we just looked at an average of people at 4.5 months after engaging in their first Green Gym session, and then we had the other 2 time points after, so 8 months after and 13 months after, but we had reduced number of Green Gym users that completed the follow-up data. So for the first follow-up point, we had about 250 participants completing the survey, and then 90 at the second time point, and then only 40 at the third time point. So what we found was at baseline, wellbeing levels of Green Gym users were significantly lower than normative UK wellbeing levels. But then at all the other follow-up points, there was no differences in wellbeing levels after engaging in Green Gym. So between the normative values reported for the UK and for Green Gym users. So at the first follow-up point, so engaging in Green Gym for an average of 4.5 months, what we found was significant increases in well-being, and these were more pronounced for people that had really low levels of well-being at the start of the intervention. And then at the second and third follow-up point, we found that the increases in well-being had sustained over the long term, and there was some evidence of further increases of well-being at 13 months. But obviously, this was we could only look at this in a smaller sample because we had a very reduced sample at the second and third follow-up points. So because we had quite a reduction in the people that completed baseline to the follow-up times, we looked to see if there was differences at baseline in these groups. So the people that continued to engage in Green Gym but didn't provide any follow-up data versus those that did provide follow-up data, there was no differences in their well-being at the starting point. And also those that left Green Gym, so we had about a third of the sample from baseline that left Green Gym, so they decided not to continue with Green Gym. There was no differences in their well-being levels at baseline. People that left Green Gym tended to be younger, and they tended to be from less deprived areas. People that continued to engage in Green Gym but didn't provide a follow-up measure tended to report a health condition and tended to be from a deprived area of the UK, and also tended to be female. So the wellbeing benefits that we've sort of observed from this data might be underestimated because we're not getting the people that are reporting the health condition or living in a deprived area complete the follow-up data. However, it's great news to know that they are still engaging in the Green Gym. They're just not sort of providing the evaluation data that we would love them to. So just to conclude, so this is one of the first evaluations of Green Gym using sort of statistical methods to examine the impact of Green Gym on well-being. We obviously, this is a problem with gathering evidence for social prescribing or voluntary nature-based activities is getting volunteers or the users to take part in the sort of evaluation phase of the intervention. So, hopefully we'll continue to work with TCB to get more evaluation data so we can look at this in more diverse groups. So, but overall, I think that what the study does show is that, Green Gym is targeting people that are that would most benefit from engaging in nature-based activities. So those that have got a health condition, people that are living in deprived areas, and those with low levels of well-being. So thank you very much, everyone.
Thank you, Nina, and thank you to all our speakers. We are exactly to time, which allows us 10 minutes for discussion. I can see lots of comments about resources. So 2 things I'll just quickly point out before we move to questions is that there are some key resources coming in the next 12 months. So NHS England have a green social prescribing toolkit, which will be in the public domain in the next year. NASP, National Academy for Social Prescribing, also have some evidence summaries coming out around green social prescribing. So there are some things on the horizon that will hopefully answer some of the things that are cropping up in the chat. But Jules, I'll pass to you if that's all right, you've been keeping an eye on the chat, and we can pose some of these topics to our speakers.
Okay, thanks, Kerryn, and thanks to all the presenters. Really great to hear the detail of everything that's happening. So the chat actually quite quiet. I think certainly one of the early comments that was raised, questions that was raised, and then echoed by I think Emma in I think maybe Dorset, something around how do people set up programs, how do people secure funding, and where do they get advice, and then also something about how to attract referrals. So I think, you know, you were just talking now in the last presentation about how do you reach the right people, the people that can really benefit from this. So that might be somewhere where we want to start. So what are the practicalities of actually setting up a new program, and attracting in the people who can most use it? John, you've got your hand up.
Yeah, thanks. I think the approach we've taken in Greater Manchester, we're extremely fortunate. We've got a really strong environmental sector with an awful lot going on already for the sake of the environment. And those things, as I mentioned in my presentation, go hand in hand with green social prescribing. So I would look at what is out there in the community already, the community-based assets that are out there, where there's already good work taking place in the natural environment, and build on and capitalise on those resources, because they're so good and just perfect for this sort of work. And then in terms of getting referrals, yeah, embedding within existing social prescribing schemes where they exist. And the thing that we've found is awareness and education for link workers who make lots of social prescribing referrals already and know what's going on in the communities. But what we have found is, in the main, there is a bit of a lack of awareness of what's on offer from a green perspective. So yeah, it's probably just a case of awareness raising and a bit of education piece, that they know what's out there and where to refer to.
Thanks, John. I'll just chip in there with the work that's happening with the cross-government Green Social Prescribing Programme, which John referred to in his presentation. They're working on. So that's preventing and tackling mental ill health. And as part of that programme, there's a lot of work going on with the integrated care systems. So really trying to work with those integrated care systems to understand the referral routes and the referral pathways. And although that programme is specifically focused around mental health, of course, it's very transferable to other areas that the integrated care systems are focused on. So I think somebody talked earlier on about pain reduction and medication reduction and that sort of thing. So there are other, and certainly my experience as a commissioner of green social prescribing before I moved to NHS England was commissioning Nature on Prescription for people who didn't want to go to cardiac rehabilitation programmes, the ones that the NHS offer, but they did want to go to the ones that the Wildlife Trust offered. So there are some other routes to consider in terms of those referrals. It's looking at the biggest picture, saying who could benefit from this. That'll give a wider scope. Anybody else want to pick up from our presenters? Okay, we've got a question. I don't know your full name. Kian S. You're showing us. You've got your hand up.
Yes, my name is Qian Sun.
Qian.
Yeah, my colleague Sureya just had to leave earlier, so I kind of pick off the question and answers on her behalf. So I'll just follow on the questions you listed from the chat. It's so interesting talking about how to start a project, what kind of resources are needed, how to get. I think that's exactly what this project, Nature's Way project, is about, to understand if more people start to thinking about to create those kind of opportunity for themselves, how to start project. It seems that what we found out is so interesting. If you are in that circle, you know where to get information. It's not, there were lots of experts in there you can refer to, but if you are slightly outside of the circle, it's a big task if you don't know what needs to be the first thing to know. So I think that's our key finding. And we also find, apart from those kind of expert knowledge, like the horticulture, like the land registration, all this very specific knowledge, there were also lots of tacit knowledge held in the community. And those kind of type of knowledge are not really kind of formally recognized. And I think that's what, like one of the case study we did, a community garden started at the beginning of the COVID, and the challenge she faced was quite dramatic. And but we can map out the journey, how she gets to the stage that the community garden starts to run. Based on that, what we're trying to do in the end is develop a platform that's those kind of enable people either got lots of tacit knowledge or those kind of new to the space, be able to co-create, to share. So it's kind of a in terms of knowledge from bottom-up way of knowledge generating, enable the community to work, and also be able to focus on place, not general kind of a topic as such. So a knowledge about also a knowledge about preferred kind of a. So that's our intention. So our platform is going to be developed in half a year's time. So hopefully I'll be able to share and circulate that information to everybody.
Thanks, Tian. Okay, so we've got Anna, and then we're at 15:56. So Anna, and then I'm going to pass back to Kerryn.
So it was very quickly just picking up on that question about how do you get referrals. I think that is a key question. I mean, I'm not medical and I'm not academic. I'm just really practical. And I just wanted to make this work. And one of the reasons I championed this project is it was so obvious, and we've all evidenced it in our presentations, that this works. And as John said, there's no shortage of green sector providers in Greater Manchester. And actually, there's a great kind of navigator care provider link. To me, the challenge seemed to be getting engagement, particularly from the GPs and the medical end of the sector, and trying to understand their world and their barriers to engaging with this. And I think there's lots of different barriers, partly, as we all hear from the news, they're just up to here. And trying to introduce another system, another option was for many of them just a complexity too far. I think for lots of them, there's probably a bit of a risk aversion. And what if I refer somebody out to this sort of unqualified non-medical provider, and then it turns out that something else was wrong with them, which I'm no longer picking up, and that comes back to get me. So kind of alleviating those concerns for them. I went to present to any number of different kind of GP groupings and practices and things, and it really came down to just finding individuals who got it. There was no kind of system-wide approach really that bought in. Either people got it or they were kind of dozing off in the corner. We tried to invite GPs out to the site. We could never get them. They'd ever had the time to come. So it might be kind of practice managers or people, but they weren't making the referrals. I really think that's key to this. And another thing that was striking from my perspective is this was only a 12-month project. And in the space of that 12 months, every single key NHS interlocutor and partner that we had on this project changed at least once and sometimes twice. So just building that consistency and confidence was really challenging. So I don't know how we solve that, but that, and actually just the practicalities, which somebody else mentioned, of the challenge of getting people from the GP practice or wherever they were referred from their house to the location, that was often the hardest part. Providing the activities and the impact once we had them, that was the easy bit. Was getting them through our door was the hard bit.
Well, thank you, Anna. It's a nice note to finish on. Understanding other people's drivers and pressures and seeing it from other people's points of view is a good message for this conference. Thank you all for a really engaging session. I think this is hopefully the start of the conversation. There's lots of links in the chat. Please do go through those, have a click through, contact people, contact the speakers, contact each other, and hopefully we can carry on the conversation. I'm to remind you to go back to the online programme and get the next link to the next session, which is around co-producing outcomes, co-producing priorities, sorry, and I'll see you all there. Thank you very much.